So, Coco and Gabby, we synchronized their vaccines a few years back. They are not due for their viral vaccines. So the viral vaccines are the ones most people know about, like rabies, for instance. It's only due every 3 years. They're not due again until 2 years from now, 2027.
Okay.
Same with distemper and parvo. Typically, that's a 3-year vaccine once they've had their first 3-year set at a year of age. That's also not due until 2027. The bacterial vaccines, though, they don't last nearly as long. Those are ones we give on a yearly basis, and that's what they're due for. So leptospirosis comes from puddles, skunks, raccoons. Here in where we are in Ottawa, it is a high-risk disease. It's something that's very easy to pick up because we have lots of this beautiful wetland around. We've got lots of creatures. So,
in Pickering, it's also because we live near the forest.
Absolutely. So it's typically a vaccine that, although by the international standards isn't considered what we call a core vaccine, I consider it the vaccine that most dogs should have, because if they do kick it up, if they do get infected with it, it attacks their liver, their kidneys. Just not a great thing. They can survive it, but some don't either, and sometimes permanent kidney damage can happen as well. So it's something that I don't mess around with. We keep them safe. The other one that, especially up here in Ottawa, but all the way to Pickering as well, I have experience with that, is the Lyme vaccine as well. So Lyme comes, the Lyme bacteria comes from ticks. Ticks, they bite the dogs. The Lyme transmits. In people, we get sick from Lyme much of the time. In dogs, a lot of the dogs will carry it very quietly throughout their life. Some will never show any signs. Some may show some arthritis. More severely though, and again, this is more rare, but it's very severe when it happens, it attacks their kidneys. So it's one that I keep dogs safe against. Like you're doing with your dogs, we use a combination. We both use vaccine to keep them safe as a backup shield, and we use a monthly preventive that you apply to them as well. That keeps the ticks from biting. If the ticks do bite, they die, and then the Lyme just doesn't have a chance to transmit from there. Good, and that's
I give them Advantix also.
Yes, so there's two main forms of medication. Each has its benefits and drawbacks. The Advantix is a back of the neck drop from there. The upside to it, it's easy to apply. It's nothing by mouth, and it doesn't absorb into the bloodstream. It actually sits in just in the oil layer of their skin.
I like it very much.
Yeah, and it was kind of the first on the field for tick prevention. Are there downsides to it? There are. Some dogs, and not your dogs, thankfully, will get this pins and needles effect on the spine. It's not burning them, but it feels very strange to them. And so some dogs just don't tolerate it at all. Certainly my Great Danes, they ran away every time they had it. So I stopped using it to switch over to the oral form from there. Second thing is, it's dogs that are getting frequent baths. Regular shampoo's okay, but if they get
I stopped to wash them a long time ago.
Yeah.
I just brush them.
Perfect. And again,
or I use special stuff I bought on Amazon. It's a leave-on conditioner. So they look perfect after that. But it's designed by Davis Lab.
Yeah.
So it's very good. It's very good for skin. No reaction, nothing, because Gabby had very bad reactions.
Yes, and so we're trying to keep her allergies,
to
whatever she's allergic to, under control from there.
Now she's good. Now she's good. Yeah.
Excellent. The only other thing that's, just so we don't think we haven't addressed it, because you and I have talked many, many times about it. Yeah. So Coco has a chronic lesion here. So chronic means it's been going on now for quite a while. It's over a year now that this. It's come and go. Okay, thank you, Gabby. So these lesions, sometimes what can happen, and what our guess is what's going on here is perhaps he got bitten by a spider or any sort of insect. He licked at it, and then all of the normal holding surfaces, the glue underneath the skin there, instead of being nicely like a grid, is more like what I describe as a big knot right now. So it's not harmful. It's certainly not growing, so we've sampled it before and not found anything cancerous or tumorous as this, but it's also unlikely to ever go away on its own, just because that tissue can't untangle itself from there. These are not ones that I rush off to surgery unless it's really bothering him. It's not something that we need to take off surgically, but that is the only way to resolve these types of lick granulomas is typically the name for it from there. And again, it's not a big deal. It's something that we we will keep that eye on that lesion on Coco's outside left wrist skin area from there, which is about 1 centimeter right now and really not changing. And last, just switching back to Gabby as well, just getting back to skin, we've also mentioned as well, she does have some small black areas on her nose. She's got one right at the plenum and then one farther back from there. They're not really changing. We tried to sample them, but they're too small right now, and it's a very difficult area to sample with them awake. Again, if we had concerns about that, we would sedate her and actually take a biopsy of these. But again, because Gabby has some unique things, not only does she have what happened with her back, but she also has had yes, exactly. So there's a very mild narrowing of the artery out of her heart called the aortic artery. We call it subaortic stenosis. She's lived with it for most of her life. We've been keeping an eye. One of the tests we're going to be doing today is the heart-specific test to make sure her heart's not stretching too much. And we'll get that back in a few days, and we'll figure out what's going on.
So we monitor it.
Monitor it, And that's the thing. We did the big monitoring, which is an echocardiogram or ultrasound of the heart many, many years ago. We got a little snapshot of her heart when the neurologist imaged her back. He found that her heart was a little bit on the bigger side. But it's about not over-treating, but not under-treating as well. So monitoring with the BNP blood test, which is the heart stretch test, totally appropriate for her, unless something started to change, like she started having fainting episodes, coughing, any signs that her heart was bothering her, we would then work it up with another heart ultrasound or echocardiogram at that point in time.